Since this case of the week is for the Halloween edition of Chairside Live, I wanted to share something with you that was kind of scary. And so what we've decided to share with you is a tiny denture that was made for a gremlin sent to the laboratory. And this devil-like creature had no upper teeth. And we were instructed by the dentist, the heathen dentist, to make a tiny denture for this Satan-like creature. And just to put it in perspective, here is a dime next to it. I miss those days. When I was growing up as a kid a lot, there was a lot of pictures of coins next to things to kind of show how big they were, but you don't see that much anymore. And the father of that tiny gremlin is a rapper. And here you see we've got basically a grill of sorts, but it actually hooks on and snaps on to the tiny gremlin's father's teeth and makes him look pretty intimidating. So now that I look at it, neither of those are really all that scary. So let me bring out something that's actually, I think, a little bit scarier than both of those cases, and that is this impression. And the doctor almost went with the Halloween theme for us. We've got orange and chartreuse. Orange and black would have been nice. I'm not sure they make a black impression material, but as we look at it, you'll begin to see some of the scary aspects of this impression. Not a lot of wash material that's in there, and first of all, we've got a big divot here. There's just a big hole in the middle of the impression here. You can tell there was either a lot of fluid or some air that was caught there. And as we flip it over, you can see the patient, half of this last tooth, half of this wisdom tooth, was actually biting down right onto the tray. And this is one of those cases, you've heard me say before how I'm not a big fan of these plastic trays because they bend a lot. That material is actually pretty stiff, and so we don't see a lot of flexure there. But anytime you're going to use a plastic impression tray, I really request that you use a nice stiff impression material like this. For a second, let's go back to the tray that I like to use, that Clinician's Choice tray. And this is that tray, the Quad Tray Extreme from Clinician's Choice. And you can see how wide it is back here. And this is really one of the things that I love about this tray. It's also the fact that you can't squeeze it and deform it. So you can pretty much use any impression material that you want to use. But really it's how wide it is back here that I like. And they're able to do that because it's a metal tray and not a plastic tray. And so for me, I have a much easier time being able to fit a patient's arch within that tray. You can see how much wider this tray is than the plastic tray underneath it. So when we're putting it in, we'll often rehearse. So we'll take this tray even before the impression material goes in. So the patient will have the cords packed and the copper cap on, and then we take out the copper cap and we'll try this tray in and have the patient bite down on it 2 or 3 times just to make sure it's not impinging and to make sure the patient's not biting down on any part of the tray. And so when they go to close into it the 4th time, when it's got the impression material in it, they do a much better job of closing into it, and we see a lot less of this where the patient's biting on the tray. And so we really do not have a very good bite here at all. We don't have any bite that we can use. We'll have to try to hand articulate it, but as you'll see, it's just not a great impression after we poured it up, and it's going to be difficult to hand articulate. In fact, if we look at the model here, you can see some of those bubbles and voids, and there's actually a little bubble that I haven't even popped there on the top of the stone yet. And so we get something like this and we look at it and we realize we probably aren't going to be able to use it. But just to the point of talking about the impression tray, if we put this tray over the arch, we can see how much room we have. So we have a lot more area to be able to move back and forth, buccal and lingually, and be off a little bit and still have the patient get together. Whereas on this impression tray, it's really, it's long. It comes so far forward and it's so narrow at the same time that you really have to fit it over that curved arch, and it makes it much more difficult to do. And if we look at, you can see here when we pour the opposing impression, of course, that this tooth is only half represented and then the patient was biting on the tray for the rest of that. And so as far as something scary to share with you, this is kind of a scary impression. Besides the fact just that it's orange, it's the fact that this was sent in and a dentist was pretty sure that we were going to be able to make a crown for this. I mean, look at that void, that huge void on the distal lingual right there. So this is scary. It frightened one of our technical advisors, and she's now going to have to call the dentist and ask, pretty please, can we have a new impression?